Hi everyone, really excited for this live session. This is Mahima. I'm sure if you've been seeing our live sessions with Lo, you would have met me, but I am a fellow curly hair enthusiast and I'm very excited to take you through this live session as we have a very special guest and we're going to talk about something that is relevant to many curlies out there, which is scalp and acne issues and product buildup. And to tell us all about it, Dr. Aswathy will be joining us. She is a dermatologist and a curls expert herself, and it is great to see someone with so much knowledge and experience to come forward and talk to us about it. So I'm really looking forward to it. And please feel free to drop your questions in the comment section below, and we will answer them to the live session. For those who are joining the live session but do not know what the topic is about, we're going to talk about product buildup, which is accumulation of product on our scalp, which leads to dandruff, hair loss, greasy roots, dry and dull hair. And Dr. Aswathy is going to guide us on what's the best way to avoid a situation like this, because this is something that I think most of my girlfriends who I know, when I speak to them, they talk about this also. So I am going to quickly add her to this live session right now. And thank you so much for joining, and please feel free to drop your questions. We're here to answer them all. Just a second. Us very, very soon.
Hi.
Hello.
Can you hear me again?
Yes, I can hear you.
Let me change it.
Hi, Dr. Aswathy. Thank you so much for coming to this live session. We're really grateful to have you here.
Thank you for calling me.
And I can see so many people have just joined in anticipation of you.
Thank you.
So, I want to start with asking you about what's your curly hair journey been like? How did you find this path?
Like any curly girl, my childhood was continuously despising all the my curls and always wanting for a straight hair. So each of us would have had that phase, and I also went through that, and I always wanted to have a straight hair. But luckily, I didn't chemically straighten or even attempted to do that because I already had long hair, and actually I didn't know how to care for that. So it was very late in my life. Actually, by 32 years of my age, I came across curly girl method. Then my voice is low. Can you?
Yeah, I
Yeah.
think your
Now,
voice is low.
now is it okay?
Yeah, I think it's still a little low. If
Now?
you could just speak,
Yeah,
yeah,
it's
near
okay
your
now.
mic. Yeah,
Can you hear?
that might work.
Can you?
It's still a little low. I think you can try without your earphones
Okay.
if that's okay.
Now? Now is it okay?
Yeah,
Yeah,
it's perfect. Loud and
thank you.
clear. Loud and clear.
So,
Yes.
everyone had that phase, and by 32 years of age, I came to know about the curly girl method, and I started practicing that during my postpartum period, immediately after my childbirth. So then the first 1 year was really very bad. I didn't have any results or anything, and it was really frizzy and sticky and everything. So that transitioning period was very difficult. But eventually, I got the hang of it. But what helped me was reading and knowing more about. Even though I am a dermatologist, we are not trained regarding curly hair. or hair care as such. Like we learn about the diseases of hair and how to treat them and everything, but hair care is not something that we dermatologists have in our curriculum so much. There will be something like using shampoos and conditioners and everything that we know, but in depth knowledge regarding ingredients and how to use the products and what we have to know about each and every type of hair and everything, we didn't know anything about that. And I had to read a lot, really a lot of literature, lot of studies, and I had to go through many books even. So that was what helped me in my journey. And also then I thought there were so many myths and like ignorance surrounding the curly girl method and the hair care itself. So then was the starting of my profile on Instagram. So the main aim was just to debunk the myths and everything. I didn't intend to get into the techniques or even any tutorials or anything. The intention was just plain debunking of myths and regarding the science of curly hair. But by time it evolved, the page evolved, and now it has so many tutorials, and we discuss everything regarding curly hair care, the techniques, and how to manage and everything. So it has been a great journey for me.
Yeah, it looks amazing, and it's so nice to hear about your journey, because one thing that you said was so right. Transitioning is hard, and I think a lot
Yeah.
of people give up. So I think helping people to stay on their journey is a really important thing, and that you're doing really well. uh, I also quickly, before we move on to our topic of discussion, I wanted to ask you, how did you marry dermatology and curly hair together? Even though there was no like rule book for you to even go back to, like as you said, you never learned about this, and like
Yeah,
how did you do
because
it?
I think my journey or my there was a basic for me. Like we study a lot and lot about like 3 years about skin and hair alone. So that is a we learn about more concentrated on the skin part more, and also people don't know like dermatology is not a sole subject. It also involves venereology, like the sexually transmitted diseases. And also when we are doing a post graduation, the hair care or the skin care has a very low part in our curriculum. Like the curriculum is not designed for hair care or skin care. It is mostly for diseases and treating that. So for me, learning about hair care and also skin care, though the cosmetology is very much advanced now, during the post graduation, we are not too much into cosmetology. Like we don't have much exposure and we don't have much time also. Like we have lots to study regarding the diseases, so that don't get time to study about skin care, like how to pair hyaluronic acid or how to pair niacinamide and all. We don't get time. So it is always a learning experience after that when we practice. When we practice, we need more of skin care and more of hair care also to like treat and advise our patients. So that was a learning journey. And regarding curly hair care, it is entirely different as well, because we are not at all exposed to that. So having a basic of dermatology, basic idea and a basic knowledge, that has helped me a really lot, because I could like go through lots and lots of research articles and books and everything, all the scientific terminologies and all that comes easy to me, because I am trained to learn that and trying to understand that the scientific jargons and everything. So that was easy for me because I had a basic. So that is what makes a difference also. Like when you are a dermatologist, you can identify where people are going wrong, and we will have an algorithm. Like when we are training as a doctor, we always have an algorithm to identify an issue. So that is the training you get, and that has also helped me a lot.
That sounds lovely, and like I think today we're going to learn a lot from you, because this is an issue I think people also go back to dermatologists to, which is product buildup, which leads to scalp issues and acne and like lots and lots of problems. So I want to first start this discussion by asking you, like, what is product buildup, so like our audiences
Okay.
can understand
Yeah. So
this issue.
products, whatever hair care product you intend. So regarding the products, like what we use, the shampoos, even the conditioners, the leave-in conditioners, and the stylers, everything. The common thing is that they all are formulated to adhere to your hair. That is a common thing that binds all the hair care products, because the hair has a negative charge, and to reduce that negative charge and to make it really smooth and the cuticles to be smoother, what we need are conditioning ingredients, and these conditioning ingredients have to bind to the hair. So this binding property or the affinity these products have, that is the thing that gives the difference. When you apply a product, the difference is because of the substantivity or the amount of adherence the product has to your hair. So that is what we need, and that is a good thing also. But what happens is that when we continually use these products, they build up layer over layer with time, because we are not completely removing those products from hair or scalp in between. That's the thing that leads to product buildup. So, what is the thing that happens on the scalp as you see as flakes? What is the science behind that? I'll just go to what product buildup do on scalp and what it does on hair. So, firstly, in scalp, when does the product build up? One is the application of shampoo. We always know that shampoos are not completely a cleansing ingredient. It always has a conditioning ingredient also, because our newer formulation of shampoos, they always have conditioners to reduce the harsh properties of the surfactants or the cleansing agents. So they always have conditioners. So when we are applying shampoos, like the usual moisturizing shampoos, we know the creamy lathery shampoos we use, they will have some amount of conditioning ingredients that can build up on scalp. Also, the hair mask or the conditioners, though we apply or we take care not to apply it on the scalp, some amount will go on to the scalp. Next, coming to stylers. The stylers, in curly hair, we have this scrunching motion, right? So, inadvertently, when we scrunch, we tend to go near the scalp and do this motion. So, somehow it will reach the scalp. These stylers can reach the scalp also. So all these products can be built up. Along with this product buildup, there will be dirt from the usual daily, your commute and everything. Sebum from your scalp. Sebum is a natural moisturizer or the oil from your scalp which acts as a conditioning agent. That from your scalp, and also pollutants. And the smoke, which also the cigarette smoking or the other smokes from the effusions and everything, fumes and everything, that will also get into your scalp. So all these five things, they constitute the buildup. These together form the buildup when we see it as flaking. So when does it flake and why does it flake? So what we are seeing, these flakes, are they products itself? Not necessarily, because all these products, the pollutants and everything creates a oxidative stress. It creates a stress on your scalp. And how does the scalp respond? The scalp responds by releasing the cells or the exfoliation, or the scalp will exfoliate itself. So that is what you are seeing as flakes on your scalp when you don't wash your hair for long. So it differs for everyone, right? The amount of sebum that you produce, the amount of flakiness you face when you are not washing. For some, it may be after 2 or 3 days. For some, it may be after 1 week. So that depends on the person's susceptibility and also the amount of sebum, like the oiliness of their scalp also, and the type of products they use. So all these differ from person to person when they will see this flaking and when they will feel the buildup happening. So this was regarding the buildup on your scalp. Now going to the buildup on your hair shaft. So that we will be seeing as a dry or a dull or a bad hair day. Essentially a bad hair day. When you feel the hair is frizzy, you are not wanting to touch your hair, it feels sticky or dry and rough everything. So that is the product which has accumulated over your hair shaft and you have not been removing that. So this is essentially how buildup occurs on scalp and on hair.
Okay, that was really well described. I think the very broken down into simplistic terms to make us understand like how it works. I never thought that like hair has a negative charge. That's why we need so many products. But it's great to like learn all of this. So, how do you prevent this from happening? Like despite like shampooing, like how, because once the product buildup settles, it just gets a little hard to, you know, take it off. So how can people
Okay.
prevent this issue?
So that will also we'll consider it into like product buildup on your scalp, how to avoid that, and product buildup on your hair, how to avoid that. So one thing for product buildup of your scalp, the main thing you have to see is that know your scalp, like how much oil you are producing, what is your scalp type like, do you have an oily scalp or do you have a dry one? So oily scalp will tend to be greasy, and you know that the sebum that we secrete, it reaches only till the 1.5 inches of your hair, and especially for curly hair it doesn't go beyond that. So the sebum will be traveling only till the 1.5 inches of your hair. Beyond that the sebum don't go. So the sebum is the main thing that causes your greasiness, and also the product buildup in the form of, if you are using a shampoo with cationic surfactants, that is a one thing which is a conditioning agent. You know, like shampoos have a list of ingredients. There will be like some shampoos may have like 10 to 30 ingredients. So most of them are like conditioning products. So they will also build up. That is the one thing. And also the pollution, the type of like the commute you take, how you go for work, the type of exercises you do, how do you work out and everything, the sweat and the grime and everything. So these are the things that you should know about your scalp. Firstly you have to know the scalp, and then you have to set the frequency of getting rid of that buildup. So if you have an oily scalp, frequent shampooing is a must. That you have to understand, because whenever there is a common parlance that a harsher shampoo can strip out your sebum and increase the sebum levels, but that doesn't actually happen. The thing is that sebum levels are regulated by our hormones, that is our testosterone. The male sex hormones are the ones mainly which regulates our sebum levels. So using of a shampoo do not have much of a role. Like it can cause some variations and all, but doesn't have that amount of like it will reflexly increase your sebum or anything. That doesn't happen. So if you have an oily scalp, what you have to do is you have to increase the frequency. Like if you are having a once a week wash day, you have to increase it to once in 2 or 3 days. And for a dry scalp even, you can use whatever symptoms you have, like when your scalp is feeling itchy or sticky, that is the symptom you have to see, or when it is feeling flaky, and accordingly you have to give a shampoo. And what kind of shampoos you have to use, that should be a clarifying shampoo. And a clarifying shampoo doesn't necessarily mean it is sodium lauryl sulfate or SLS. Clarifying shampoos can be other anionic surfactants which are milder. Like sodium lauryl sulfate will strip out all the buildup and it will really cleanse your hair, that is for sure. But the issue is that when we are using the SLS on the hair shaft, there are lipids on your hair shaft which will be removed, which is called 18 MEA, which is the thing that gives an integrity to your hair shaft. So to avoid that 18 MEA being removed, the lipids from your hair shaft being removed, clarifying shampoos which are milder are also available. So you have to use clarifiers in a particular frequency which will suit your scalp type and your daily working atmosphere. So that is one thing. Then next comes the use of exfoliants. The exfoliants we use on scalp can be milder, like glycolic acid, lactic acid, and salicylic acid. And when to use salicylic acid and when to use glycolic acid. For an oily scalp, salicylic acid. And for a drier scalp, better to use a glycolic acid. So what does it do? Salicylic acid will regulate the sebum levels and reduce it, and glycolic acid will give an exfoliation from your dry scalp, causing it to remove those buildup. So these are the 3 steps for your scalp buildup. And for hair, of course, clarifying shampoos. That is a one thing you can do for your hair shaft and the frequency also.
Okay, so that, I think basically we have to first identify our scalp type to the T, and I think you have given us enough information to go back and like observe how our scalp reacts and exfoliate. So I wanted to ask you another thing, like how does like, so even to get rid of this problem, it takes a certain period of time, right? Like I feel like a lot of people start thinking product buildup is dandruff. Are they the same, or are they related? Are
Okay,
they
yeah, I saw a
different?
question also. Is it flaking, is product buildup, or is it dandruff? So essentially, dandruff and product buildup are 2 different situations that you have to know. Dandruff is a medical condition, which is a mild case of seborrheic dermatitis, which is a kind of eczema. So what happens is that dandruff is closely related to the amount of the fungus, the commensal, the normal fungus that you have on your scalp, the malassezia. The amount of fungus you have, the growth of fungus you have, that is the thing that controls and exacerbates the dandruff you have, and also your individual susceptibility, like your individual body type. That is the one that determines how you have a dandruff or not, and how severe it is also. And product buildup is what we explained. But the thing that relates these two is that this product buildup creates an environment which is conducive or good for this fungus to grow. The Malassezia fungus can grow and thrive in a situation where the product buildup happens, because it is a sebum rich, oily situation which the fungus likes. So what the fungus does is that the fungus grows on this, it releases the fatty acids from the sebum and creates an inflammation. So this inflammation is what exacerbates or increases your dandruff. So when you have product buildup, you can also see that your dandruff can get increased. So that is how these two are related. So whenever you have an issue of a dandruff, we always say that you have to wash your hair with an anti-dandruff shampoo with active ingredients which reduce the fungal growth, which is ketoconazole, selenium, zinc pyrithione, etc., which can reduce the fungal growth and reduce your dandruff. So that is also, in a way, reducing your product buildup, because all these anti-dandruff shampoos usually have an anionic surfactant also, which is busting your product buildup as well. So in a way, the treatment is also related and the conditions are also related. So the thing I have to say is that if you are a person who has dandruff already, you are facing dandruff, then the product buildup can increase that. But if you are not a person with a dandruff already, you are having a very good scalp till now, but you are using a product and then you see flaking. That is product buildup. That is how you can recognize these two. So a pre-existent case of dandruff can get increased by product buildup, and it can also continue as well. Even if you, the one thing is that even after taking your treatments, if your dandruff is exacerbating, there may be something that you are adding on, like you may be allergic or your product may be causing an issue in case of dandruff. So that is a thing you have to identify and manage accordingly.
Okay, got it. I think that was really well explained. It makes sense. We just have to, I think, understanding the cause and like the triggers really helps people to tackle this scalp because it's so unique for everyone. And I think these are some points that everyone will really take home and like think about. I wanted to ask you like one last question before we move and start taking questions from people is that uh, like a lot of curly hair people also complain of acne breakouts. So, what's your advice
Yeah,
to them
the
after
product,
this?
it may not be, may or may not be related to the built-up issue. The one thing is that the common thing that all curly hair products have is that they're rich in oil and butters because we are trying to mimic sebum. The sebum reaches only till a part in curly hair. It doesn't progress beyond that. But in a straight haired person, the sebum can be made to come down by brushing. But for a curly hair, the brushing can cause much damage. There can be cuticular damage when you dry brush your hair. So we avoid dry brushing. The sebum stays there. So the purpose of the curly hair product is that we are mimicking the conditioning effect of sebum by giving oils and butters in our products. So these oils and butters, though they mimic sebum, they can be comedogenic. By comedogenic, we mean they are acne causing. So whenever you are finding you are starting with a new product, you have started on CGM, I receive multiple DMs regarding that. You are finding small bumps on your hairline, like here or your neck area, small bumps like your whiteheads, or you're having acne or pustules, having pus or reddish lesions on your hairline or even inside the scalp. It can be a condition called pomade acne. Pomade acne is due to products like the acne form, the comedogenicity of the products which leading to acne production. And also if you are a person with an acne prone skin or you are facing acne already, there can be an exacerbation, like you can see bigger pustules and bigger lesions on your cheeks and everywhere on your forehead everywhere. So that is a condition where you have to immediately stop the product, because if you continue that, the condition is going to get worsened. You are going to have more of acne and eventually scarring. You don't want that. So immediately stop the product. The oils contained in the product, it can be coconut oil or shea butter or cocoa butter, anything can be. So even some products may have other oils which we may not recognize may be comedogenic. So immediately avoid that and wait for the acne to reduce. And also consult your dermatologist if it is turning into a pustule or acne is very much exacerbated. You always have to seek a medical help in such a condition. You may need oral or topical antibiotics, everything. So in such a condition, always take the help and also try out another product which may be lighter. Like always read the ingredients. That is what I always say. Like reading the ingredients helps you really a lot. Like read the first 5 ingredients at least, so that you know what the product has in majority. So that will always help you.
Okay, thank you so much. I think we have learned very valuable lessons from this live session on not just product build up, but like how to identify your scalp, how to like take care of your scalp based on your unique needs. And I think you've broken it down so well because of course to like see it in very scientific terms can get very intimidating for like laymen like us, but you have broken it down so well and made it so understandable. Thank you so much, Dr. Aswathy. Uh, Everyone, please, if you have any questions, drop them. So, Dr. Aswathy can answer all your questions. And uh, yeah, please go ahead and drop your questions. I think one person had asked before, like something related to hair loss, uh, a while back, which they started seeing after a lot of build up.
Oh,
It was in
yeah.
the beginning of the session. Yeah. Can a person with bald spots, alopecia use CGM routine and
Can a
the
person with
products?
alopecia?
This is a question.
Uh,
Bald spots use CGM routine and use
Okay,
the
yeah, I think
products.
they are meaning alopecia areata. There are different kinds of alopecia. So, alopecia areata is an autoimmune condition. For that, you need assessment by your dermatologist for your scalp condition. That is particularly a scalp condition, and it is not related to your hair shaft or your hair care. So, but if you are being prescribed your usually, the first line would be like a topical steroid or a topical tacrolimus or anything. So that may be used after wash, or there may be a routine that has been prescribed by your dermatologist. You have to adhere to that because the hair gain is happening over a long period of time, and you don't want to interfere with the scalp health at that point of time. And I would suggest that you wait for the hair growth to happen. Being an autoimmune condition, there is a tendency for alopecia areata to recur, and more of lesions can occur with time. And for a bald spot, a completely bald spot to regrow hair, it may take a period of 3 months or so. So that is a condition or a medical condition which needs more of attention and more of care for your scalp. So I would always suggest not to interfere with that session and with that routine that your dermatologist has prescribed. And after your hair has grown completely or started even growing, you can try out the curly girl method by adding one product at a time, because you have always have to avoid the chance of any case of contact dermatitis, and dermatitis at that time won't be helpful for you because it will add on to your issues, because alopecia areata is itself is a very stressful condition. So always add a shampoo, always add a rinse out product at first, wait for a time of 2 weeks, look for any other contact dermatitis or any eczemas happening, any allergy happening, then only add your leave-in product one at a time at the frequency or interval of at least 2 weeks in between. In that way, you can add on curly girl method and with caution.
Okay. I think we have just one last question
Yeah.
that we will ask you, which is I have an oily scalp. I do exercise, cardio daily. I get a lot of sweat. I have some dandruff and I've got pimples on my scalp. Scalp got itchy and smelly. What is the solution to
Okay.
get rid of
So,
this?
if you're working out every day, there will be sweat and grime on your scalp, and it can get smelly. The one thing is that if you want, that is also regarding your personal choice. If your scalp doesn't allow infrequent washing, the only way that you can wash your hair or reduce the oil or the sweat is, one is by using a dry shampoo. But not everyone is like liking use of dry shampoo, because it may result in a dry hair near the scalp and everything, that there may be too much reduction of oil. So one is regarding using of a dry shampoo, and the second one is by using a co-wash for a daily washing. So if you are a person who wants to daily wash your hair, at least use a cleansing conditioner to wash your hair. But the risk is that by doing so, you can increase the buildup on your scalp. So the key is using a clarifying shampoo once a week. That would be like if you are co-washing for 7 days a week, it is a must that you should use a clarifying shampoo at the end of your week because you will get buildup on your scalp and also on your hair shaft, and by the end of it, your hair will be over conditioned. Even if you're avoiding the use of stylers in between, the hair will be over conditioned and you will feel it is very frizzy and like wispy and everything by the end of your week. So you have to reset your hair by the end. That is one way to go. And also another way to go is that by using a scalp serum which has salicylic acid. If you are having a oily scalp, you can use a pre-shampoo treatment of salicylic acid. There are different products available like a gel or a serum or a leave-in product and everything. There are multiple products with salicylic acid now. So you can use that in between and do a co-wash. So these are the options you have.
Okay. Thank you so much, Dr. Aswathy. I think today's live session was really, really enlightening because I've always never really gone back and understood the roots and the causes of all these issues, and to actually understand them, it makes everything very simple. It was such an honor to have you here, and I can see so many people were so excited to join your live session also because it's always enriching. I really
Yes,
hope you enjoyed too, and we hope we can have you more often so we
thank
can
you.
learn more from you.
Thank you
Thank you
for
so much.
having me. Thank you. I
Thank
love the session.
you. And same, same. We really loved it. And for everyone who's missed it, don't worry. We're going to post this on our page so you can watch it whenever on your own time. Thank you so much, and please take
Have
care.
a great
Have
day,
a
you
great
too.
day. Yeah.
Bye.
Okay. Bye.